All right. So we will be discussing basic sanitation and hygiene for today. So here we have an introduction of the more common contaminants that you may see within the hospital premises. Although this does not necessarily mean that these are contaminants that you will only see in the hospital premises. These are also contaminants you may see at home or in the general environment. So there are multiple types of organisms that are present in our environment. In the hospital, one of the most common you will see are bacteria, fungi, yeast, molds, and viruses. So, just to give you a basic idea of what these more common contaminants are, we will proceed with the lecture. So, here are just some visual aid to give you an idea of what they may look like under the microscope or on a plate agar. So, examples of bacteria that may commonly be found in the clinic. Staphylococcus species is one of the most common contaminants anywhere, simply because this is what we call normal flora, which we may find on our skin. When you say normal flora, these are organisms or bacteria that normally you would find on your skin, whether or not you were a healthy person or if, let's say, you had a skin condition. This bacteria is something you would find if you were to swab your hand, swab your skin, and put it on an enriched agar. This is commonly a bacteria you will end up growing. So, one of the other reasons why you're regularly advised to wash your hands, whether or not you've handled a patient that's healthy or a patient that may be sick. Right? So Escherichia coli is also a common contaminant. It normally causes diarrhea. I would assume that most of you would be familiar with it. Um, More commonly called E. coli, which is commonly a problem that you see in places that would have murky water or dirty water. In cases of swimming pools that may be infected with E. coli, that's usually a red flag. People are told don't go swimming in the pool because it's E. coli contaminated. Because this bacteria can easily cause disease should you have ingested or have been exposed to too much of that bacteria. Now, E. coli or Escherichia coli is very common in slaughterhouses. Why? Because it's commonly a normal flora bacteria for the gut. So, like humans may have a certain level of E. coli in their gut. Animals would have a certain level of E. coli in their gut. But normally, when it's not a diseased condition, meaning they're not sick of the E. coli, this is usually what we call normal flora. But once your immune system is down, or if you have a concurrent infection by something else, then E. coli could proliferate and become a disease condition. Now, one of the very, very important thing to remember with E. coli is that it is one of the fastest growing bacteria. You have, let's say, one E. coli bacteria, and it'll multiply every 15 minutes. So exponentially, when you add that up, every 15 minutes, it will multiply exponentially growing. You would have millions of it within a day. This is one of the reasons why E. coli is a very, very well-known bacteria. Now, Pseudomonas is also a common bacteria that may be a contaminant, and it usually causes respiratory infection. It's usually the bacteria that causes the greenish tinge in your mucus, or when, let's say, you have a cold. Pseudomonas is a very common bacteria to be found in secondary bacterial respiratory infection. So just visual aid of a dog having diarrhea. Okay, now we go to viruses. The more common viruses is the parvovirus and the distemper virus. All right. If you notice the picture of the puppy that's under the parvovirus, well, the reason why we have that puppy as a picture is because parvovirus usually infects puppies. On occasion, it will infect an adult, but in general, it does not. And symptoms of adults with a parvovirus infection is very, very different from that of a puppy having a parvovirus infection. Usually, it's the heart that's affected in a parvovirus infection in adults, in adult dogs. And this rarely happens. So we'll concentrate on parvovirus in puppies and possibly in cats. So let's start out with puppies. Now, your common symptoms in a parvovirus infection is diarrhea, shortly followed by vomiting. So it's very common that you will see vomiting and diarrhea in a parvovirus patient. Now, it may initially start as a regular diarrhea, but it's not uncommon for the diarrhea to become a bloody. For you to have bloody diarrhea, or your patient or your puppy to have bloody diarrhea succeeding a couple of hours or days starting from the symptoms. So your mode of transmission is fecal-oral. What does fecal-oral mean? Well, if you dissect the root word, fecal meaning feces and oral meaning mouth, so basically your mode of transmission is from feces to mouth. We're not talking about a dog eating some other dog's poop, although that is possible. But basically what we mean when we say fecal oral, it's when you have a contaminated area that's been pooped on by a dog, puppy, or other that may have parvovirus in it, and then he licks that area that has been contaminated with the parvovirus feces, or he, let's say, moves around his toy within the contaminated area, and then he starts gnawing at his toy. Those are possibilities of transfer. Parvovirus is a very resilient virus. What does resilient mean? Basically, it's pretty hard to kill. Even without the host, the parvovirus stays alive within the environment. So it's resilient in terms of it's fairly hard to kill unless you specifically want it you want it dead. You disinfect the area and really have the means of killing the parvovirus. Right now, another thing to remember with parvovirus is that it doesn't only infect puppies or dogs. It can also infect cats. And when it does infect cats, it's no longer called a parvo infection, although it is caused by parvovirus. It's more commonly known as a panleukopenia infection in cats. Right? So panleukopenia infection is caused by the same virus that has somehow adjusted or has changed somewhat in the strain, that it has mutated into a cat, or has mutated enough to infect a cat host and cause panleukopenia infection. Therefore, it's very important for you to remember, just because you have a puppy that has a parvovirus infection and you have a cat or a kitten right beside it, just because it's different species, just because the one patient is a dog and the other is cat, it doesn't mean that it cannot cross. So you always have to be careful in handling a parvo patient that's a dog or a puppy, and you have to be very careful to handle another dog or another puppy to make sure that you don't infect the other puppy, the same way that you have to be careful about handling a cat or a kitten after handling a parvo patient, because you can infect both the other puppy and the cat or the kitten within the ward. So you have to take special precautions. In general, even if it wasn't a parvovirus, even if it was some other disease, the general rule we have is you always wash your hands after every patient, whether it's an OPD, an outpatient, or it's a confined patient. You always wash your hands, or you glove up and change gloves. This avoids any cross contamination. This avoids any spread of disease, regardless of what the disease is or the infection is. All right. Now, what would be the time frame if, let's say, a household had a puppy that was infected of parvo? The recommendation that you would give or advise a client is that you don't get another puppy. Even if that pup with parvo died and they no longer have a dog within the household, it's not recommended for them to purchase or acquire another puppy shortly after losing the parvo infected puppy. They need to wait at least 6 months to a year with regular disinfection of the whole household to help clear out the parvo before they put in a new puppy. Because it's very likely, because parvo is resilient, it's very likely that that new pup could get the parvovirus from contaminated areas in the household, right? And it's also very important to note that puppies that survive parvovirus, that live to a long ripe age, it's important to remember that these survivors are intermittent shedders. What do we mean by intermittent shedders? This means that at any point in their life, when they poop, you never know if they're shedding or they're pooping out a parvovirus. So it's always recommended that parvovirus carriers or parvovirus survivors are not exposed to any other puppy because they could be infecting that pup. So for breeders, you usually tell breeders, if this pup is a parvovirus survivor, you really shouldn't be breeding it. It really shouldn't be in a breeder's kennel. All right. So next, you have distemper virus. Distemper virus is more commonly just affects dogs. It can affect dogs, it can affect puppies. So whether it's an adult or whether it's a puppy, these dogs can be susceptible to distemper virus. Now, what's the mode of transmission in distemper viruses? It's airborne. So it's highly contagious. You have to be very careful with mixing a patient that's distemper positive with a patient that's distemper negative, because merely staying in the same room, a negative dog could get infected with a positive dog. This is primarily the reason why we have as an isolation waiting area, why we have an isolation ward, and why we have an isolation room. These specifically are for patients that are positive for distemper, because you don't want to expose them to the general population because they will infect a negative dog. Now, in terms of resiliency, distemper isn't as resilient as parvo. What does that mean? Well, basically, it means that if, let's say, you wrapped a distemper patient with a towel, and you've gotten that towel contaminated with distemper, right? And then you take the towel away, you put it aside. Distemper on that towel will probably die out within 30 minutes to an hour. They're not very resilient. Without a host, they don't survive very long. But what's important to remember with distemper is that it may not survive very long without a host, but it's easily transferred from one host to the other. Hence, we take very, very good care about possible breaches in biosecurity when it comes to the isolation ward. Right. Now, in terms of symptoms, what do you usually expect with distemper? Well, there are quite a number of symptoms, but the more common, easy symptoms to recognize that will automatically give you a red flag and tell you, oops, this patient has to go through the isolation waiting room. We can't put it in the main area. It could possibly be contaminating the hospital, or it could be passing on distemper. Well, the symptoms that you will usually be looking out for is, one, you have thick nasal or ocular discharge, and it's usually green. You have thickening of the foot pads or the paws. You have neurologic symptoms like muscle twitching, especially if it's involuntary. You have chewing gum motion, or what we call chorea. You have seizures, usually when the patient comes in lateral and has paralysis. That's usually a flag for distemper. These are automatic cases that you, as nurses, should be able to detect and say, hey, even if the vet's not here yet, we're going to put it in the isolation waiting area just to be on the safe side, right? So, another common disease, rabies virus. This is a virus that's been hyped up by the Department of Health. People think, oh my God, rabies virus. I've gotten bitten. I'm going to die of a rabies virus infection. Most of you, I'm not even going to bother to ask, but most of you will probably think rabies virus is innate in the dog or in the cat. Now, how many of you think of that? Think of it that way. Like it's like saying that the dog has the rabies virus, but it's just there dormant. It's not really a disease yet until after he bites a human. I'm pretty sure a lot of you think that's the case. Well, it's not. Rabies virus, just like any other virus, has a mode of transmission. The mode of transmission for rabies virus is blood to blood transfer, meaning you have a rabid dog, do a transfusion on a non-rabid dog with the blood from the rabid dog, then you will probably infect the non-infected one with rabies. You also have the more common, which is saliva to blood, which is bite wounds. I think there was a show before. It was called Scrubs. The doctor on Scrubs made the mistake of using a dying person's organs and donating it to all the other patients that needed an organ transplant without realizing or without screening for rabies, because it was such a disease that was so rare in the States. He didn't screen for rabies. He started donating the organs, and lo and behold, 1 week later, all the patients that received the donor organs starting to present with symptoms with rabies. And unfortunately, there is no cure for rabies. The most is you do an immunoglobulin shot and hope and pray that it kills off the rabies virus to save the infected patient, right? But again, let me reiterate, rabies is not innate in the dog or cat. It doesn't just sprout out when it bites somebody. No. It has to go through a mode of transmission. So basically, if you have a dog that's been indoor all its life, has never been exposed to any other animal, the risk of it being rabid or the risk of it having rabies is almost close to zero, right? Now, rabies virus infects any mammal. What is a mammal? Okay, people, this is a grade school question. You should know what a mammal is. A mammal is an animal that's warm-blooded, can regulate its own temperature, does not lay eggs, rather, but gives birth to live young, and produces milk. That's where the word mammals come from. Mammary glands. Basically, if the animal has mammary glands to produce milk for their young, that's a mammal, right? So remember that rabies can only infect mammals. So a rabid dog bites a bird, the bird will not get the rabies. All right? All right, so next we have fungal yeast mold infections. Well, fungal infection, the most common is the ringworm or Microsporum canis, right? Even people get that. And really, if we have a patient that has that type of fungal infection, it can easily transfer to you just by handling that patient. But you have to remember that although we have a high risk of transfer of zoonotic diseases, the basic thing you have to remember is that if you practice proper sanitation, proper hygiene, you're not likely to get any of them. Whether it's scabies or it's a fungal infection, you won't get them if you practice proper hygiene, which is wash your hands, clean, and take a shower. When you shower, use soap. Just practice proper hygiene and you'll be fine, right? Now, most fungal infections we've noticed in the Philippines is usually caused by improper management or improper sanitation of grooming. material or grooming equipment. So you have a dog that's been groomed in a grooming center. It happened to have a skin problem. There was a long line of pets wanting to be groomed, and the groomer decided, hey, there's just too much things to do. I'm going to just move on, clip this dog, clip the next dog, clip the next dog, without disinfecting their clippers or cleaning their scissors or their brushes or their combs. And this is usually the very first or the most likely way of contaminating and spreading the disease. All right. So this is well, it's an example of a ringworm. You'll notice with ringworms, it's very demarcated. Those round lesions are very demarcated. Um, Sometimes it's dry, sometimes it's wet. So really, there's no real way to find out if it's Microsporum, Trichophyton, Candida. There's no real way to find out what it is unless you do a culture. And fungal cultures usually take a long time to make. So or to test. It usually takes 2 weeks to do a fungal culture, and it most of the time you really don't want to wait. If you do a fungal exam or you do a Woods lamp and you know that it's a fungal infection, you start treating it anyway, even if you decide to do a culture. So, what are the common disinfectants that we may find around the grocery or in the hospital? Hypochlorite. Most of you will know hypochlorite in its brand name form, which is Zonrox or Lysol, right? In swimming pools, we also use hypochlorite. It's called industrial chlorine, which is basically hypochlorite, the same thing as Zonrox, but it's in a powder form, right? It's very effective in killing bacteria, virus, and fungi. Now, what's the downside? What's the downside with Zonrox or hypochlorite? Well, for one thing, it's deactivated by organic matter. What is organic matter? Basically, if you look at the chemical formula, you see a CHO on it, that's an organic material. Anything that's living, it's something produced by a living thing, that's organic, right? So you have poop, urine, soil, pesticides, those are organic material. Anytime that you use Zonrox in the presence of the organic material, your Zonrox, your disinfection is useless. So what does that say? That tells you that if a parvo puppy pooped on the floor and that's now a contaminated area, that area now has parvo, you can't just go on spraying the poop. The poop is going to deactivate your chlorine. It's not going to kill off the virus. What you need to do is scoop up that poop, dispose of it properly, soap down the area, wash it off, then do your disinfection. Otherwise, your disinfection is going to be useless if you don't clean up the poop or the pee before you disinfect. Right? So that's one disadvantage. Second disadvantage is that um, it, it is corrosive. It corrodes. It causes rust. Even stainless steel could possibly start rusting in the presence of hypochlorite. Third disadvantage is that it's a bleaching material. You get a drop of pure Zonrox on your shirt, chances are you'll have a white mark where that drop contaminated your shirt. So it is a very strong bleacher. Okay. Next, we have quaternary compounds. This is a common disinfectant that we use as well in the hospital. You only need a small amount mixed in with water, and it's a very potent disinfectant. Now, main issue with this product is that it's very irritating to the skin. You have moderate exposure to the skin and your skin starts drying like crazy. It's going to start peeling off your skin, right? Now, I know I said with hypochlorite it deactivates organic material. Well, with quaternary compounds, it does not get deactivated with organic compounds. But it doesn't mean that you don't clean or scoop up that poop before you disinfect. Because remember, if you have a quaternary compound disinfectant and you spray on that poop, you're probably disinfecting the outer part of that poop. But once that gets stepped on, the inner portion is still virus or bacterial laden. There's still a lot of bacteria in it. There's still a lot of viruses that could possibly be in it because you basically were just able to disinfect the outer area. It's still important to do a proper cleaning before you disinfect, regardless of which disinfectant you use. Right? So your basic cleanliness and hygiene principle is you always have to wash. Wash your hands, wash your hands, wash your hands. You handle a healthy patient, you wash your hands after. You handle a sick patient, you still wash your hands after. And in general, the requirement is soaping your hands for 15 seconds before rinsing. When we say 15 seconds, we don't mean wash your hands from wetting it to soaping it down to rinsing is 15 seconds. No, the lathering on of the soap takes 15 seconds. So it's very important that you clean and you soap down for 15 seconds before you rinse off. Okay. Again, always wash your hands. We can't reiterate this enough. Whether you're handling poop, urine, blood, whatever, you wash your hands. You're always expected to maintain proper hygiene, which is also the reason why we try to supply staff as much as possible with lotions, because with the amount of times that you have to wash your hands are probably going to get dry and you're probably going to need to put lotion regularly, right? So as a reminder, it's always important that you clean up after a patient that urinates or defecates. We have custodians that are hired for this job, but really, if a patient poops right in front of you, you don't wait for a custodian to pick it up. You don't want to wait and risk that that dog or that patient spreads that poop around. You're going to want to just pick it up, throw it in the proper trash, which is usually at the back, not where our lobby is or the reception is, because if you pick that up and it stinks and you're going to throw it in the trash right there where our waiting area is, it's still going to stink. Because come on, the trash is still there and the poop is still there, right? We have tissue paper located all around the hospital in every room that might be helpful in picking up poop and pee. All right. So there's no excuse for anybody not to be able to pick up on their own. And then maybe once you picked it up, if you pass by a custodian, you ask the custodian to, hey, could you mop that up, or could you soap it down after I just picked up the poop or the pee. All right. So basically, that ends our sanitation and hygiene. I really hope that you remember whatever I lectured and you really got um, the information that we need you to learn. We will be giving a quiz on this. So if you do need to listen to this again or watch this again, please do so. Try to get every information that we've discussed here into your head and into practice. All right? So thanks.